Hey everyone, our final lecture for exam 6 is on antiemetics or anti-nausea medications. There is a small section of chapter 60 in your textbook that covers antiemetics. So let's talk about the pathophys behind nausea and vomiting. The vomiting reflex is controlled by the medulla, which houses the vomiting center. And the vomiting center receives signals from the GI tract, the inner ear, and chemoreceptor trigger zone in the cerebral cortex, and that creates an emetic response. The reflex is triggered by feelings like fear, anticipation, anxiety, sensory input such as unsettling sights or odors, pain possibly, or by the vestibular apparatus in the ear that can be triggered by motion, disorientation, by being off balance in some way. The vomiting center will send a signal to the stomach and the diaphragm and the abdominal muscles to expel the contents of the stomach. Nausea and vomiting happen for a number of reasons and because of many different conditions. And there can be a systemic problem that can be creating nausea, vomiting, such as cancer or possibly pregnancy. It's a very common side effect of medications also. So these are the 5 drug classes that we'll talk about in this presentation. We have the anticholinergics, the antihistamines, the phenothiazines, dopamine antagonists, the serotonin 5-HT receptor antagonists, and then we're going to talk lastly about some miscellaneous medications that are used to treat nausea, vomiting as well. All right. Anticholinergics is our first group. Scopolamine or hyoscine is the prototype drug. So the mechanism of action is that it's going to block the action of acetylcholine, which suppresses the communication between the nerves of the vestibule of the ear and the vomiting center of the brain. And this drug works great to treat motion sickness and helps with nausea and vomiting. It can be taken orally or as a transdermal patch that releases small amounts of the medication over time. The patch is one that goes behind the ear, so you might have seen somebody with a scopolamine patch. The side effects are related to the anticholinergic effects of the drug. So remember back when we studied the peripheral nervous system, those anticholinergic effects: dry mouth, blurred vision, drowsiness, urinary retention, and constipation. All effects from the blockage of the parasympathetic nervous system. A common problem with scopolamine is that it will be given to patients in surgery because they have a higher risk of developing nausea post-surgery. So a lot of times patients will have one on and they get done with surgery and their nausea is controlled, but then they end up being over-sedated because of the scopolamine, or they're having a hard time voiding and they're retaining urine. Those are common effects from this drug. Our next group is the antihistamines, and our prototype or main drug that we'll talk about is meclizine antivert. So antihistamines are also used for nausea vomiting by blocking the H1 receptors, which will suppress the communication between the inner ear to the vomiting center. Blockade of H1 receptors is going to help treat motion sickness and therefore will help with the nausea. But it's a little less effective than scopolamine. So scopolamine is a better drug when it comes to treating the nausea and motion sickness. These are your over-the-counter drugs though. So these drugs you can buy quickly over the counter. And if you're going to need them for plane rides or boat rides or any other activities that you find you become sick from the motion or nauseous. Dramamine and Benadryl also fit into this category, and they're used as antihistamines to treat motion sickness and nausea. The adverse effects of antihistamines are related to the blockade of the H1 receptors, and also there's some binding to muscarinic receptor sites. This is going to cause those same types of anticholinergic effects: drowsiness, dry mouth, blurred vision, urinary retention, constipation. So these are similar to what we've already talked about before with the anticholinergics. Okay, the next drug group is the phenothiazines dopamine antagonists, and the main prototype is promethazine or Phenergan. This drug works by blocking the dopamine receptors in the chemoreceptor trigger zone in the cerebral cortex. So promethazine or Phenergan is, like I said, the prototype, and this drug is helpful in treating nausea and vomiting triggered by most types of stimuli. Promethazine also has anticholinergic effects of blocking acetylcholine and antihistamine effects blocking the H1 receptor sites. So you'll see those side effects as well. The adverse effects include the anticholinergic effects, the sedation, confusion, as well as these extrapyramidal symptoms. The extrapyramidal effects are related to the suppression of dopamine, and extrapyramidal means that there's some type of movement type disorder happening, such as tremors or slurred speech, restlessness, Parkinson-like symptoms. So that's a really serious type of side effect that can be limiting for patients that are on Phenergan. Sedation can be very, very serious as well, especially if patients are already taking a CNS depressant, such as an opioid or benzodiazepines. Promethazine can be given via the IV, can be given PO, it can be given IM. If it is given IV, you have to be careful to dilute the medication in 10 mils of saline, and to be very careful with how you administer the drug and give it slowly into the IV, because it's very irritating and can cause a lot of pain for the patient while it's being administered. So just some tips for you on how to give Phenergan effectively, and so you're not hurting your patient. The serotonin 5-HT receptor antagonists are a type that are going to block the serotonin receptors, just like the name implies, that are located both in the afferent vagal neurons and centrally in the chemoreceptor trigger zone. So it's blocking those serotonin receptor areas, and our main drug is ondansetron or Zofran. This drug class does an effective job of treating nausea and vomiting. It's used to treat nausea and vomiting associated with chemotherapy, and it's given 30 minutes prior to chemotherapy and several days after chemotherapy is done. It can be used for other causes of nausea and vomiting, including post-op nausea vomiting. Adverse effects can include headache, dizziness, diarrhea, or possibly constipation, although ondansetron is very well tolerated for patients. And there are some cardiac effects that can occur with patients that have a history of cardiac disease or cardiac abnormalities. It can lead to some dysrhythmias, so we just have to be careful to monitor those patients. And the nice thing about this drug class is there aren't any extrapyramidal symptoms happening as a side effect. All right, and then we have finally our miscellaneous antiemetics: benzodiazepines, cannabinoids, and glucocorticoids. And these are great. They're useful in treating nausea and vomiting, although that's not their primary indication. Their antiemetic characteristics were kind of discovered by accident along the way. So we'll get into these a little bit further. So benzodiazepines, our example drug is lorazepam or Ativan. This is a common benzo that's given mostly for anxiety. But it's also used to treat nausea and vomiting because of the inhibition of GABA in the CNS. It's going to cause relaxation. It's going to help with sedation of the patient. It helps for the patients to suppress the feeling of anticipation of nausea and vomiting, kind of that feeling that it's going to happen. So this is a learned response that happens for patients because of previous experiences that have occurred. And so that's going to help slow things down, help relax them, and not be anxious and thinking about what's going to happen. Patients must be monitored closely for sedation and possibly memory problems that can occur with benzos. This is related to that inhibition of the CNS. So especially if they're on other types of CNS depressants, we want to be careful to monitor them closely. And a bonus about the benzos is that they are going to help control some of those extrapyramidal reactions that might be caused by the phenothiazine group. The benzos can help with those. All right, cannabinoids is another miscellaneous medication used to treat nausea, vomiting, and dronabinol or Marinol is one of 3 cannabinoid-based medications that's approved by the FDA. It's very commonly prescribed. It contains synthetic THC, not the actual plant cannabinoid. It's actually man-made in a lab, but it mimics THC exactly. Dronabinol has been approved for the treatment of anorexia related to weight loss in patients that have AIDS. It's also used for nausea, vomiting in patients that are on chemotherapy treatments, especially if they haven't responded to other antiemetics, such as the Phenergan and the Zofran, the other drugs that we've talked about. Dronabinol effects are dose-dependent and can cause feelings of paranoia, euphoria, possibly confusion, and increased sensory awareness. It also can cause drowsiness, which can be exacerbated with other CNS depressants. So if a patient is taking other types of CNS depressants in addition to the cannabinoids, you worry about the drowsiness. Hypotension can be a possibility as well. It should be used with caution in patients that have psychiatric diagnoses such as mania, depression, schizophrenia, because these symptoms can be exacerbated. It is kind of expensive. The cost is around $200 to $800 a month for dronabinol, so that might be an issue for patients. And then finally we have our glucocorticoid antiemetics. We have methylprednisolone or solumedrol and dexamethasone, Decadron. There are 2 examples of these glucocorticoids that are used to treat nausea and vomiting. The mechanism of action isn't really truly understood of how they work to treat nausea, vomiting. But we know that steroids are treating the inflammatory process in the body. They're used with chemo, nausea and vomiting related to chemo, and also acute post-surgical nausea, vomiting. So more acute type situations with temporary use, and they're always combined with other types of antiemetics. If a person has severe nausea, they're going to be combined with some other drugs. So it's not just the glucocorticoids by themselves typically. Okay, and that wraps up Exam 6 content. Please let me know if you have any questions.